Good evening, friends. We'll start with the new session today. We have learned up to the aphorism number 94 in last lecture, and we're discussing regarding the case taking in chronic diseases. The aspects in detail, as explained by Hahnemann, are we are discussing in this session. Every aphorism in this session or in this aphorism, every aspect of chronic case taking is very thoroughly maintained by Hahnemann. Each and every question regarding the case taking, he tried his level best to explain as with the help of footnotes, with the help of examples. And that's why we can gain a lot, we can learn a lot from him. So we have finished up to the 94, where he has mentioned about the certain specific questions related with the occupation, related with the mode of living and diet. Those you have to ask, or you have to take the information regarding those things, along with the, in cases of females, the details about the menstrual history as well as the abnormal discharges such as glycoria. And all those things we have discussed in yesterday's lecture. Let us go ahead with the aphorism number 95, where he has explained one more thing, and that thing which is necessary sometimes to find it out the remedy. So what he wants to say, let us see. In chronic diseases, the investigation of the signs of disease above mentioned and of all others must be pursued as carefully and circumstantially as possible, and the most minute peculiarities must be attended to, partly because in these diseases they are the most characteristic and least resemble those of acute diseases, and if a cure is to be effected, they cannot be too accurately noted, partly because the patients become so used to their long suffering that they pay little or no heed to lesser accessory symptoms, which are very often very pregnant with the meaning, in bracket characteristic, often very useful in determining the choice of the remedy, and regard them almost as a necessary part of their condition, almost as health, the real feeling of which they have well nigh means almost, well nigh forgotten in their sometimes 15 to 20 years of suffering, and they can scarcely bring themselves to believe that these accessory symptoms, these greater and lesser deviations from the healthy state, can have any connection with their principal malady. So, one more important aspect of accessory symptoms he tried to explain over there. And this is quite common when you deal with the chronic cases who are suffering from their diseases from 15 years, 20 years, 25 years. In such types of cases, whenever a patient comes to you, he generally is very familiar with his disease. He doesn't understand what is characteristic of them, or many a times he considers that is part and parcel of his state of health. He never considers few features as a symptoms of the disease. And that's why when you ask any questions, he will not going to tell you anything regarding this. This happens many times in your case taking. You deal with the patient and they talk vaguely in chronic cases. And those vague answers never leads towards any remedy, because you are in the jumbling, because there are many more remedies in our homeopathy. There is nothing specific, there is nothing characteristic which is giving you some clue toward the remedy. And it happens many times because patient has forgotten that he wants to tell about those symptoms. And what he says, those symptoms are very pregnant with the meaning. Means they are having lot of meaning in them. They are very characteristic of the case, and which we miss because patient is habitual to the just a simple case taking, telling only the broad symptoms without explaining the details of it. And all those things happen. When such questions you ask precisely, is there anything related with the physical general examination or in personal history, and you just give the stress to certain points, then patient starts narrating about them. And these symptoms many times you miss. For example, patient generally miss that he is having the periodical aggravation of the complaint. For example, patient who is suffering from the migraine since long time, 20 years of headache, which is there. So he forgets the modality, even though those are very important. It is the, for example, a patient is having very typical new moon and full moon aggravation, but he will not going to tell you this new moon or full moon aggravation because it becomes so habitual to him. He will come to you and he will say, yes, doctor, I'm having this semilateral headache, and doctor diagnosed it as a migraine, and that's all. If you poke, if you ask them precisely, is there any specific time you get this headache? Is there any specific thing because of which you get headache? Is there any circumstance because of which you get headache? Then you can gain something about it. Otherwise, you don't never get anything. You get pure diagnosis, migraine, and it never helps because it will not going to give you any remedy. When you want and expect a perfect remedy, you require such types of symptoms. Then you have to ask, and then patient tells you, doctor, every new moon and full moon, I get this aggravation of my headache. It generally definitely starts over there. Yes, this is having a meaning. Then you ask how it starts, where exactly it starts. And then he defines exactly. Otherwise, he will talk vaguely. Yes, I have headache. But if you ask specifically how it starts, where it starts, in which direction does it go, and then he defines. Doctor, it starts on backside, then it turns up, then it goes to the vertex, and then it settles on one of the eye, specifically the right eye. Now the symptom has become very specific, fertile. Now it has become very clear. Now you get a remedy which has that capacity, which has that typical headache, which has that typical migraine. And then you can think about the cilicia in such types of cases. Because now that accessory symptom, which was not told by the patient because he becomes habitual to it, and that's why you never get the detail. Many times, the complaints related to the stools, constipation, patient forgets to tell you. It becomes part and parcel. Same patient of migraine comes to you and you ask regarding it, and he casually answers. When you poke clearly, then he explains, yes, doctor, I have constipation, I have hard stool. Many times I have to remove them mechanically. Then you confirm your prescription. Such types of symptoms which are very much necessary, which are giving a meaning to your main symptom, which are giving you exact state. But because of habitual thing, they forget to explain it to you, and which are essential in your case taking. And that's why Hahnemann says it is a time to ask regarding all those things. Tell him everything is important. Just think over it. Anything else you have, any problem do you have? And then if you ask them again and again, then they will narrate all those things which are essential for your prescription, with which you can reach to the right remedy. Many times patient comes, doctor, this child was not having anything, and all of a sudden he started getting the problem, and he's having this epilepsy. And since last 6 months we are giving these medicines, and still it is not working. He never had since he is 3 years old child and not have anything. Then you ask what has happened exactly, where it has started. They think over it, and then sometimes they answer, doctor, one thing has done. It has started just after giving him a vaccine. We have given certain vaccine to him, and thereafter the problem has started. Yes, you get this accessory symptom, which is very important from for your prescription point of view. And these are very essential in the cases. You should not miss such types of symptoms. And that's why in chronic cases, whenever you are dealing with the patient, you have to ask all those details from the patient. So on the 95 aphorism, write down on side accessory symptoms during case taking, importance of accessory symptoms during case taking. And for the exam going students, this is a question, short note, accessory symptoms during case taking. You have to write down what exactly it means, then definition, then importance of it in homeopathy, and how patient forgets to tell all those accessory symptoms while narrating the case. So this is the importance of accessory symptoms in the case, specifically in chronic case. Now he turns towards the one more aphorism, aphorism number 96. And here again he gives something very essential from the case taking point of view. Besides this, patients themselves differ so much in their disposition that some, especially the so-called hypochondriacs and other persons of great sensitiveness and impatient of suffering, portray their symptoms in too vivid colors, and in order to induce the physician to give them relief, describe their element in exaggerated expression. Vivid means विविधचा अर्थ बरेच जण विविध करतात, तसं नसतं ते. विविध म्हणजे स्पष्ट, भडक. भडक इज व्हेरी टिपिकल आन्सर. Strongly appearing. So, vivid colors. Generally, those patients who are specifically those who are specifically hypochondriac. What is hypochondriac? Anyone knows what is hypochondriac? Undue anxiety regarding their disease is called as a hypochondriac. So they are quite exaggerating their complaints. They are quite exaggerating their problems, exaggerating symptoms. So these are hypochondriacs. So such types of patients, you observe them in your OPD. What happens? They ask you many questions. First important thing. They ask you n number of questions. They are so anxious about their disorders or their children's disorders. You can observe them in them, and you can find it out. They are always ask you. They goes outside, again return back, and then again ask you question. So such types of patient, they goes out and returns back. This is very typical with the hypochondriac. They even leave the consulting room, and after some time again calls you, doctor, I want to ask one more thing. This is a hypochondriac. And when such types of patients are there, their mind is like that, that if you ask, if you tell them certain thing, they never immediately get agreed. They tries to exaggerate their symptoms. They tries to show that they are suffering a lot and you are not paying attention to them. In order to attract your attention, they exaggerate their symptoms. And that is what is the hypochondriac personalities are there. And these personalities generally affects the human being. These personalities generally are very sensitive. And these personalities tells you many things which are not present over there. So this is too important. One should not forget, one should not miss, and one should understand what is going on. This is too important to understand. So think over it, that what he explains, portray their symptoms in too vivid color, and in order to induce the physician to give them relief, describe their element in exaggerated expression. One patient was there who was suffering from the chronic rhinitis. He has consumed lot of medicines. He was a teacher when I was in the school, and one day he came for homeopathic treatment. So I took his case completely, and I found that Sabadilla was the remedy. I have given Sabadilla 200 to him for 15 days, asked him to return back. He was a patient, he was a hypochondriac patient. In fact, during case taking also, he asked me many questions. He again returned back, again explained and asked many things. And when he came for follow, to start with, he started little bit better is there, but not too much. I expected that I should get cured from you, but I I was not getting that result. I was expecting from you such a cure. And he has exaggerated all his symptoms. What has happened? I I retook the whole totality, and I found that remedy is found to be the same, because he was showing all features, typical running nose with typical watering from the eyes, with lot of sneezing, aggravated in the whenever he goes out, whenever there is a draft of air, everything with a frontal little bit headache, all those, all the stuff which is there with the Sabadella, that was there with him. So the remedy was very correct. So I considered it might be a, I have not given hypotensia, let us give him hypotensia. So I have given few doses of 1 m, and thereafter I have continued with the placebo. And when I have given those doses, the next day he returned back and he explained, yesterday I was very good and you have given this medicine and it has aggravated my problem. And then I asked, you told me that you are suffering. Then he explained, actually I was very good. I expected if you give high dose, it will be cured forever. And that's why I have explained in such a manner. So such a thing commonly happens in early practice generally. And that's why you must be able to understand the hypochondriac nature of the person, so that you immediately catch out, yes, whether patient is telling you truth or whether he is exaggerating his symptoms. And that differentiation one must develop. So in this aphorism, he tried to explain that you must be careful with exaggerated symptoms as explained by hypochondria. And there is a footnote he has written over there where he explains the examples of it. The footnote number 89 something, 88. Okay, we'll read that footnote 88. A pure fabrication of the symptoms and sufferings will never be met within hypochondria. Even in the most impatient of them, a comparison of the sufferings they complain of at various times when the physician gives them nothing at all, or something quite unmedicinal, proves this plainly. So, how to understand that person is hypochondriac? This is one more thing. You give him a placebo and tell him that yes, this is very strong dose and it will work very instantaneously. You sit over there outside and you will find the result. And he comes after 15 minutes and he says, yes, sir, that remedy was very strong. Yes, I got very good result. The patient will narrate in such a manner. You have given him unmedicinal nature, the placebo, and it worked. So such thing happens in such cases. But we must deduct something from their exaggeration. At all events, ascribe the strong character of their expressions to their excessive sensibility in which case this very exaggeration of their expression when they're talking of their element becomes of itself an important symptom in the list of features of which the portrait of the disease is composed. So sometimes patient comes and patient tries to uh, tell you symptoms, and he while telling the symptoms, he's much more exaggerating. He tries to show the tremendous expressions while explaining the symptoms, and such a thing creates the problem. When you tries to do such a thing, it always creates the problem. It always because you are not understanding the level of susceptibility, because of which if you misunderstand the susceptibility, you might give him a wrong potential. This is another problem which develops because of exaggeration of the symptom. And that's why it is necessary to understand exactly how much patient is really suffering from. For that purpose, my suggestion is that always examine the patient. You observe, you clinically examine. If he is complaining of any pain, just see whether it is really tender. Divert the attention of the patient and just check that part. And if he really is in that severe pain, he will immediately cries out with the pain. But if he is not really in pain, then you can find it out the severity of it is not that much severe. So such types of patients you have to clinically verify. Verification is very important, and then you have to consider, is it real or it is not real? Whether you have to deduct something from what patient is telling, or you have to take into consideration all the things whatever patient has told you. All those things matters a lot, and that's why many times you have to be careful when you get such types of hypochondriacal patients in front of you. So, and what he says to conclude that footnote, the case is different with insane persons and rascally fiends of the disease. Insane means those who are mad, vedsa. Rascally fiends. Rascally fiends म्हणजे अप्रामाणिक लोक. मराठी डिक्शनरी मिनिंग तर त्याचा नीच हलकट असं दिलेलं आहे. These are the peoples, and these are the peoples who will going to give you very wrong perception, wrong expression of their complaint, and because of which sometimes you miss a very important remedy, and this should not happen. So whatever he is explaining over there is is the thing that in cases of hypochondriac patient, try to find it out the reality, try to find it out the truth, and then take into consideration the patient's symptoms. Second important thing in earlier aphorism, he has given you the importance of accessory symptoms which patient miss while explaining his or while narrating his case. And those are having a lot of meaning. That's why Hahnemann used very important word. They are pregnant with the meaning. They are characteristic which guides you towards the right remedy. Both things are necessary when you deal with patient. So one time, in one case, you have to find it out the whatever is there. In another case, you have to find it out what extra patient has told. Two opposite poles, you can find it out in chronic case taking. And such types of persons you can get in your OPDs. So be careful and find it out exactly what patient wants to tell you. So reality matters a lot. So first case, think about the accessory symptoms from the patient. In second case, find it out the exaggeration from the patient, both of which are necessary. So we'll stop over here. Tomorrow we'll continue with the next aphorism. So we have finished today the two more, that is the 95 and 96. So thank you being there. Any queries, questions are there? If you have any queries, questions, we can discuss, or otherwise we conclude the.
सर
Yeah.
सर जितने भी हाइपोकॉन्ड्रियक पेशेंट्स आते हैं जरूरी है कि वो मतलब हमें एग्जेजरेट कर रहे हो या उनमें से हमें फाइंड आउट करके निकालना होगा कि भाई कुछ लोग होते हैं ना वो ओवर सेंसिटिव होते हैं
Hmm.
अ, तो
That's a question of judgment. ये सबसे important है judgment. You have to understand. That's why you should be very careful when you deal with the patient. You should
हम्म,
not get involved with each and everything. You should be a third person when you deal with the case. Because when you become third person, then you can catch everything. If you get involved, then you can write down each and every detail, and sometimes you miss because many unnecessary things have been added by the patient. This is possible in hypochondria. But when when you develop that eye, whether the patient is telling the truth or whether he is exaggerating, that you have to
हम्म,
develop. It is part and parcel of your experience. It matters. Every time it is not there with hypochondriac, but this tendency is always there with hypochondriac.
राइट
Okay, anything else?
सर यूजुअली जो एल्डरली खवातीन होती हैं ऑलमोस्ट 60 क्रॉस और 65 years of age they have a issue of inconsistency of urine, they cannot hold the urine.
Hmm.
सर इसमें मैंने कॉस्टिकम भी यूज की और भी एक दो दवाइयाँ लेकिन कोई बहुत ही अच्छा रिजल्ट नहीं मिल सका मुझे.
Uh, Basically, you have to find it out what may be the reason. In case of males, it is because of BP, benign enlargement of prostate. And that if it is so, because of which urging develops in them, they have to go
हम्म,
for urination very fast. That urging develops because of benign enlargement of the prostate. And if it is so, then you have to think about the remedy which acts on prostate specifically. One should not forget in such cases the Sabal cellular, a very important
हम्म,
remedy. Benign enlargement of prostate, Sabal cellulata, is very important in the mother tincture. It helps to reduce the
हम्म,
size and it removes the urgency. That is very important because this urgency is quite common in such cases.
yes, sir.
That is one reason. In cases of females, if it happens because the urinary bladder comes down. There is cystitis or cystocele basically. If it is cystocele, that may be one of the reason because of which urging is there. So you have to tell them proper exercises, which is too important, and with which they can regain the strength. So such things are very, very important in such cases.
सर वो कौन सी एक्सरसाइजेस.
Perennial contraction, that is very important. Contraction of the perineum, that is very essential when cystocele is there. That helps a lot. The exercises which we used to explain or tell the patients for the prolapse of rectum, prolapse of vagina, cystocele, that perineal contraction exercise is very important for you.
राइट.
There, there was one question, sir, in cases of chronic diabetes, how should we approach the case? Patient wants to reduce metformin dependency. Is it possible with homeopathic treatment? Yes, basically, it is a big session we have to take on diabetes. We'll do that whenever time permits, and within next month, I will do that because it is not a question which can be asked within 5 minutes. You have to learn the approach, how to deal with the diabetic cases, how to stop metformin, what is the importance or role of diet in diabetes, how one should follow the diet. It is a big issue. Uh, if time permits, in one of the Thursday session, I will deal with that. So That I will discuss in that session. It is a big topic. Okay.
Right, sir.
Okay. How was
rubric session also left, sir.
Yes. वो प्रॉब्लम वही है, मुझे 24 आवर्स ही दिए भगवान ने. Okay, we'll try our level best. Okay.
Thank you, sir.
How
Thank you.
was yesterday's session?
Sir, yeah, yesterday's session,
Nice.
sir, very nice. I saw it twice, sir. एक्चुअली जितनी मरतबा मैं एक चीज नोट कर रहा हूँ, आपकी जितनी मरतबा देखता हूँ चीज उतनी ज्यादा और क्लियर होती है. तो मेरे ख्याल में जिस चीज को समझना है वो इस टिप को जरूर करें कि रिपीटेडली देखें तो और ज्यादा क्लियर हो.
ठीक है, कल मिलेंगे. कल नहीं, मंडे मिलेंगे. विल मीट ऑन मंडे, नॉट टुमारो. ओके.
राइट. थँक यू
सर सर LM पोटेन्सी कुठल्या कंपनीचे स्टँडर्ड वगैरे?
मी मेडिसिनचं वापरतो. मी पहिल्यापासून मेडिसिन वापरतो. दीपाली भोसले, हॅव यू जॉइंड द डिवाइन स्कूल? If you have not joined, just send 500 rupees to ourselves, be a member of Divine School of Homeopathy, and you will become part and parcel of our school. That is one-time fee, 500 rupees. You can contact Dr. Prerna. I will let you her number. 74 724 042 978. You can contact Dr. Prerna on this number. She will let you know how to join, and if you join, then everything will be open to you. Thank you. So those who have not yet become member, they should join our school, and it's only 500 rupees forever. You don't have to pay it again and again. Okay. Thanks a lot.
थँक्यू सर.